Today's medical-centric topic is folic acid for men, not just for babies. Here's why you need it. Folic acid usually gets attention for its role in pregnancy, but men, don't scroll past this one. This B vitamin isn't just about growing healthy babies. Folic acid plays a big role in male health too, from fertility to heart protection, and even mood and brain function. Let's unpack why men should care about folic acid and how much you actually need. What is folic acid? Folic acid is the synthetic form of vitamin B9, found in supplements and fortified foods. The natural form in foods is called folate. Your body uses it to make DNA and RNA, support cell division and repair, produce healthy red blood cells, regulate homocysteine, an amino acid linked to heart risk. Why men need folic acid too. 1. Boosts fertility. Studies show folic acid may help improve sperm quality, especially when paired with zinc. It's been linked to increased sperm count, better sperm shape and motility, lower DNA fragmentation in sperm. If you're trying to conceive, folic acid can support healthy sperm production, possibly improving your chances of successful conception. 2. Supports heart health. Folic acid helps lower homocysteine levels in the blood. High homocysteine is linked to a greater risk of heart disease, stroke, and blood clots. This B vitamin helps break it down and flush it out. 3. Brain and mood benefits. Folic acid plays a role in the production of dopamine and serotonin, brain chemicals tied to mood and motivation. Low folate levels are linked to depression and brain fog. Some studies show folic acid supplementation may boost the effects of antidepressants in certain men. 4. May lower cancer risk. Although more research is needed, maintaining healthy folate levels has been linked to a reduced risk of colorectal and prostate cancers in some studies. How much do men need? The recommended daily intake for men is 400 micrograms of folate or folic acid. Most men can get this from leafy greens like spinach and kale, beans, lentils, and asparagus, fortified cereals or breads, supplements if diet is lacking. Any risks? Folic acid is safe in moderate doses, but too much, over 1,000 micrograms, can mask a vitamin B12 deficiency, especially in older men. Always check with a healthcare provider before starting high-dose supplements.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.